The NHS Prescription Services is a part of the NHS Business Services Authority. One of our core functions is to process the NHS prescriptions dispensed in primary care and arrange reimbursement and remuneration payments to contractors. This video will help you to improve your pharmacy's processes for submitting and endorsing prescriptions so that we can pay you accurately and on time. After submitting your monthly account of paper prescriptions and EPS tokens, they arrive here at the Support Services Department, where we unpack, sort and scan 11,500 accounts every month. Approximately 1 in 4 items processed are now submitted via EPS message.
Here's an example of a well-packaged account. It's separated correctly and bound securely and safely. The prescriptions have been sorted correctly and the white dispensing tokens and green prescribing tokens are separate. But unfortunately, not all accounts come to us like this.
Sometimes they aren't in the box, or the box is too big and the prescriptions can become disorganised.
Or they aren't always separated or sorted correctly.
Submission documents are used to calculate any advanced payment, so it's really important that they're filled in correctly.
We need to know the number of chargeable and exempt prescriptions and items, along with the dispensing staff levels or the number of hours spent.
As you can see on this example, the pharmacist has stated the number of EPS claims included at the top of the submission document, and this is really helpful to us.
We get a lot of submission documents that have been torn in half, but this means we can't scan them and have to produce a new one.
One thing people might not realise is the need to use the submission document that has been sent to you for use in that particular month, as the barcode on each one is unique to you and to the submission period.
If in doubt, just check the guide that is included in the document, opposite the area that you're filling in.
After we receive and unpack your account, the forms are scanned back and front to get a digital image to work from. A few problems can occur during scanning, but are easily avoided with some help.
EPS tokens don't need to be scanned as they are not required for reimbursement purposes, and all of the information we need is included in the electronic message.
Some post-it notes on forms can cause a scanner to jam or make it difficult to read what's on the prescription. Removing the stickers can pull the ink off the form or leave residue, sticking 2 forms together.
They don't need to be stapled together. For example, when you're submitting a number of prescriptions for the same patient. Contractors can think this is helpful, but we need to take the staples out so they can be fed through the scanner.
Please remember to sort your RA forms separately too.
So with your batch now stickerless, stapleless, and without your RA forms and ETP tokens, it's ready to go. Remember to get your account to us by the 5th of the month, or by the date stated in the drug tariff if you're enrolled on the Pharmacy Earlier Payment Scheme, so we can make your advanced payment on time. And you can submit your EPS claim at any time after it's been dispensed. You don't have to wait until the end of the month. Once with us, the first stage for paper forms is the charge status, where our staff check the chargeable and exempt status of prescriptions, moving at a speed of over 2,000 processed forms per hour. Prescriptions are never switched from chargeable to exempt, or vice versa by our software. Instead, it identifies forms that might need charging, and a staff member will then check and switch the form if necessary. Let's see if they have any tips to help and prevent your prescriptions from being switched unnecessarily.
All prescriptions should have a signature in the patient's signature box.
And we're unable to accept stamps in place of a signature.
Don't forget that the exemption category should be clearly ticked.
With EPS messages, if the patient's age is calculated as being age exempt, the items will be processed as exempt. To ensure the items are processed correctly for a patient who isn't age exempt, please ensure that the charge value is populated correctly before you submit your message.
To calculate payment due for items prescribed on paper prescription forms, we use an intelligent character recognition, or ICR software, to scan the forms. However, the ICR can't read every item prescribed on paper. Any items that the software is not confident in reading, such as handwritten, complex, or unusual items, require user intervention. This is where our 1,100 processing staff come in. With the electronic prescription service, however, there is no ambiguity, as our systems use the unique SNOMED code in a structured message format. Assessing the items that have been unable to process automatically, staff capture and correct information to get a payment made wherever possible. Despite this, a large number still need to be sent back to pharmacists for further information. The good news is, a high percentage of the delays can be avoided. Here are some ways to minimise the number of items that are returned.
For EPS messages, endorsements must always be in the dispenser endorsement field, and if the prescriber has ordered a presentation of a drug that doesn't exist, make sure that you endorse it with the presentation you dispensed.
If the prescriber amends the prescribed item by adding extra detail, for example sugar-free, to the dosage instructions field,
if you've endorsed something incorrectly and have already submitted your claim, you can't amend it unless you have claim amend functionality.
The status of all items should be indicated as either fully dispensed or not dispensed for you to be able to submit the claim. You will then need to update the message status to indicate any not dispensed items.
For the paper forms, try to keep any endorsements completely in the endorsement column, as they can be hard to read if they're obscured by other detail on the form. And if you need to endorse the invoice price for a drug, always state the pack size, price and supplier.
If you've endorsed something incorrectly on a paper form and it is no longer needed, take time to get it clearly crossed out, otherwise it can cause confusion and lead us to return the item for clarification.
Also identify any drugs not dispensed by scoring right through the item and endorsing ND alongside it. And where appliances listed in the drug tariff with a range of sizes and colours are prescribed, we need all of this information to be able to process the item.
If there is a catalogue number for appliances, stating it in the endorsement column can also help to identify what you have dispensed and prevent a returned item.
If you're claiming SP, remember to mark it in the same column directly alongside the drug it relates to.
Among the most time-consuming and complicated items that we process on paper prescriptions are those prescribed in instalments, on FP10 MDA forms. We're constantly striving to ensure that your payments can be made as quickly as possible, and there are a few ways you can help.
On the right-hand side of the prescription, where you indicate the instalments dispensed, make sure each box is completed for every endorsement. Fill in the drug, quantity, date and signature so we know exactly what has been dispensed.
If you or one of your members of staff have initials matching endorsements, such as ND, which can also indicate not dispensed, or NC, which can also indicate not collected, it would be great if you can use a full signature instead, as these can create some confusion.
And try to keep endorsements in the endorsement column. If you dispense more than one day's instalment at the same time, mark it clearly on the right-hand side of the form.
We're not expecting returns to be eliminated entirely, and sometimes they still come back without the correct information to calculate an accurate reimbursement. But there are ways we can stop this from happening.
We often get returned items sent back in and with no additional information added. We can't process the item without the information we've asked for, so in these cases we have to ring the pharmacy directly to ask for the information we need. This takes resources away from your dispensary and is time consuming for our staff too.
It's common for us to get extra information added for the wrong item on a form. All the information added will be different to what we've asked for, or doesn't give enough detail. Take care to check the text above the box on the image we send you. That will tell you exactly what we need.
Remember, the same endorsement requirements apply to resubmissions too. So for example, if you're adding an invoice price for a drug, you need to include a pack size and supplier as well.
You may also find that an electronic prescription needs to be returned for clarification. You will receive a paper image of the message, and the same information is required as for paper prescriptions.
There are less EPS returns than for paper prescriptions. However, common reasons are not endorsing a manufacturer for a non-drug tariff Part 8 item and not endorsing an invoice price where required.
For special or unlicensed items not listed in Drug Tariff Part 8B, please remember you need the following information.
And that's it. By following the best practice tips and processes we've listed, we can ensure our payments to you can be accurate and on time, every time. You can get more information and advice by visiting our website at www.nhsbsa.nhs.uk. You can also ask questions using our knowledge base, Ask Us, which you can access from the website homepage.